We'll now be inviting our final group up, and their presentation is entitled The Increase of Psychiatric Diagnoses such as ADHD and Autism in Adolescence.
Good morning, my name is Taliyah, and I'll be introducing our presentation which focuses on the rise of autism and ADHD among adolescents in Brazil. Adolescents are children between the ages 10 and 19, a key period in life for physical, emotional, and brain development. There has been an increase in diagnosis of attention deficit hyperactivity disorder and autism spectrum disorder, ASD, both neurodevelopmental disorders among adolescents in Brazil. Many adolescents in Brazil with these conditions don't receive the proper care or support they need. This lack of assistance harms the whole, not just the individual. The rise in diagnosis presents challenges for many things, like educational institutions, healthcare systems, and families. Now I'd like to pass it over to Sidney Radford.
Good morning, my name is Sidney Radford, and I'll be presenting the burden of disease. There are a multitude of factors burdens on those not only are diagnosed, but also those responsible for their care. In Brazil, 38.7% of informants who were diagnosed could not afford their care, and 36% had a family member who stopped working due to a cognitive disorder. This puts a strain on the income available not only for household needs, but also the amount of money they can allocate towards their treatments. Due to the uniqueness of the diagnoses, programs and treatments are specialized and tailored to the individual. This influences individual costs and intervention program expenses that could potentially disqualify patients from access to services. These disorders are also lifelong and evolve over time, which can accumulate large sums of money. In conclusion, the primary burden of these cognitive dysfunctions is the inevitability of large expenses and potential financial struggle. And now I will pass the board.
Good morning, my name is Zyra, and I will be discussing today about our program development called Include Kids Brazil, which mainly focuses on improving identifications of autism, ADHD, in young children in Brazil. Our main goal is to make assessment more accessible to families and assist teachers in recognizing early signs. To identify autism and ADHD, we'll have a universal screening for all children before age 5. Specialized diagnostic centers provided to reduce wait times also. We'll also have behavioral therapies available both in public and private settings. Parenting accessible in online and in community health centers. Parent training programs that teach strategies to manage behavior and support management at home. We'll ensure access to pediatric neurologists and also access to child psychiatrists for medication management when needed. Now I'll pass it on to Tori Richardson to continue our discussion.
Hello, my name is Tori Richardson, and I'll be continuing the program development. Supporting children with autism and ADHD demands coordination across education, finance, and policy. For schools, we enforce individualized education plans for every child, hire neurodevelopmental specialists, and train teachers in inclusive spaces for diverse needs. For families, we require respite care to combat burnout and networks for sharing strategies, services, and advocacy. For federal and state systems, we update national registries via health and census data for better resource planning with policies, committees of parents, clinicians, and educators, evidence-based standards. And associations that can help would be the Global Autism Project and Brazil's Association of the Friends of the Autistic, AMA, to simplify building that strengthens programs nationwide. And now I'll be passing it off to Karlee.
Good morning, I am Karlee Parker, and I'll continue our discussion of recommendations and implications. The premise of our research was to learn about the significance of the increase of ADHD and ASD within adolescents in Brazil, the millions of cases that were diagnosed post-COVID. Going into our program development, the first step is identifying the problem of ADHD and ASD within the adolescents. Secondly, hiring medical and evidence-based professionals that can find the symptoms within the adolescents.
moving into education and integration within the curriculum system and public awareness, following, helping and supporting families of children who do get diagnosed with autism and ADHD, and lastly, with public policy, going into government, asking for monetary assistance, along with healthcare resources. The implication of our program shows the need for advocacy and care in regards to the high incident rates of ADHD and ASD within adolescents in Brazil. Through this process, we learned that parents and children both need support in finding treatments and solutions for ADHD and autism. Preventative actions, monetarily, educationally, and through integration are great steps to build a firm foundation for future cases. And prevention and intervention programs are effective ways of change and transforming populations that deal with health disparities and challenges. That is the end of our presentation. Thank you for listening.